Hello and thanks for joining us. I'm Dr. Alan Mask. I am an internist here in North Carolina and also the medical reporter for WRAL TV. Let me pose a question. Are doctors, nurses, dentists, and advanced practitioners doing everything they can to help prevent infections during routine procedures? Experts say that we could be doing more. North Carolina continues to see transmission of illness and outbreaks of infectious diseases such as hepatitis B and C, where patients have been infected because of unsafe needle and medication practices during routine procedures. Now, to address this problem, we're here to spread awareness about a rule, the North Carolina Administrative Code, that requires healthcare settings, such as doctors and dentist office, to have a staff member on site who is trained to prevent these types of events. The rule is called 0206. Now, joining us to talk about infection prevention and this code 0206 are two experts, Dr. David Weber and Dr. Zach Moore. Dr. Weber is a professor of medicine and pediatrics at the School of Medicine here at UNC. He's also a professor of epidemiology in the School of Public Health, the associate chief of staff for UNC hospitals, and the medical director of the statewide program for infection control and epidemiology. Dr. Moore is a state epidemiologist and chief of the epidemiology section of the North Carolina Division of Public Health. And Dr. Moore, we'll start with you. Tell us about this Rule 0206 and how it got started.
Sure. So Rule 0206, as we usually call it, is a rule in our North Carolina Administrative Code that dates back to 1992. And when it was first put in place, it was intended specifically to prevent the spread of HIV and hepatitis B in healthcare settings. So Rule 0206 has two basic requirements. The first requirement is that any healthcare setting that performs clinical care and performs invasive procedures has to have a written infection prevention policy. Now, this applies not just to places that are conducting surgery, but to any place that uses needles to puncture skin. So this is if your facility draws blood or gives injections, then this rule does apply to your facility. The second main requirement for the 0206 rule is that one staff member in each facility has to be responsible for this infection prevention policy, and that person has to complete a state-approved course in infection prevention.
Mm-hmm. And Dr. Weber, tell us about your experience. I know you're here at UNC with this rule and how it applies to what your practice is all about.
So this is